Changes to the Medi-Cal program, updates and conditions. Hello, I'm Kevin Canals, an independent health insurance agent in California, and the Department of Healthcare Services has provided a high-level overview of some of the changes that will be going into effect in the coming years regarding the Medi-Cal programs that are related to either state budget issues where they change some of the rules, and also because of the one big beautiful bill at the federal level, which has changed some of the enrollment eligibility conditions. So I'll just go through these fairly quickly here. The big thing that a lot of people have already heard about is the asset test, the asset limits. Beginning January 2026, you will need to have less than $130,000 in assets as a single individual in order to qualify for the Medicare Savings Program and Medi-Cal. So you have Medicare and Medi-Cal, you need to have less than $130,000. And if you are married and additional dependents, it's $130,000 plus $65,000 for each individual. And this really goes to those people who are, 65 years and older that have Medicare, or under 65 with Medicare, to qualify for Medi-Cal, Medi-Medi as they are known. And the counties will need to look at all of the assets, and that will include bank accounts, cash, more than one vehicle. It's important to note that some assets are not included, such as your primary residence that you live in, one vehicle, household items like maybe a clock collection, some savings, and retirement accounts. So there will be more information forthcoming. Now, if you are already Medi-Medi in 2025 and you've come into the program, everything's good, you will not be subject to the asset condition until 2026 at renewal time. If you are coming into Medicare and Medi-Cal in January 2026, they will be looking at your assets in January. The enrollment freeze. So for some adults that were not documented, you could get Medi-Cal. That is freezing, and they will not be accepting any more applications, and that starts January 2026. And they talk about if you are already in the program without the proper immigration status and whatnot, you can keep it, but you need to really watch the letters that are sent to you and read the documents so that you don't miss any letters where they're requesting information so that you can keep your coverage. And you can still get full scope Medi-Cal if you are 19 years, under 19 years of age, pregnant, but you must still meet some other Medi-Cal rules like income and living in California. So the Department of Healthcare Services does have one page that talks about all the different immigration statuses and what programs those individuals are eligible for. And I have that here in red, and I just took a little snippet of it. The adult expansion enrollment freeze applies in 2026 to adults 19 plus who are not pregnant and are undocumented. So that will be going into effect July 2026, summer. Dental coverage will be pared back. And so essentially adults Denta-Cal will be going away, and you won't be able to get full scope, dental care, the routine care, if you're, older than 19, unless you're pregnant, and there's a few other conditions, but otherwise it will be going away. Now, if you have full scope Medi-Cal and it's been pared back, you still can get some dental services for urgent and kind of emergency situations like serious tooth pain, infections, extractions. But of course, it's the routine care that helps prevent, the urgent and emergency situations. There are dental HMO plans that are reasonably priced, anywhere from $10 to $20 per month, and then they have a set co-payment fee schedule for dental care services. I think to have a filling was like $25 or $30. So some of those are reasonably priced, but of course, if you have no money, then even that is beyond your means. July 2027, monthly premiums will be coming into effect for Medi-Cal members. And this, again, kind of is targeting adults that are MAGI Medi-Cal, Modified Adjusted Gross Income Medi-Cal, also known as Expanded Medi-Cal in California. So they may have to be paying a premium, a monthly premium to keep that coverage. I'm sure it'll be very low and reasonable, but we don't know how it's all going to play out. And it's down the calendar over a year. And now, if you don't make the premium payments for the full scope Medi-Cal HMO plan, you will still be able to get emergency care and pregnancy related care and some people that are in nursing homes. So it won't be a complete, embargo on healthcare services if you don't make those premium payments, but that's something that could impact some people. And this is the big one that a lot of people have a lot of anxiety over, the work requirements. And it's very important to note that the work requirements for Medi-Cal do not come into effect until January 2027. That's when adults with MAGI Medi-Cal will need to prove that they are working or they're volunteering or something of that nature to retain their full scope Medi-Cal, MAGI Medi-Cal benefits going forward. We have to do that every 6 months. But there are a lot of exceptions to that, such as children, adults that are 65 years old, because they generally have Medicare, pregnant people, parents with children 13 years of age or younger. They won't have to have the work requirement. People with serious health and mental health conditions, and people obviously with Medicare Parts A and B, and there's some other exemptions there like foster youth. And it says that members must do one of the following: work at a job and get paid at least $580 per month, be in job training, volunteer for community service, be going to school. So there's a lot of different ways to get the exemption so that you can stay with full scope Medi-Cal. Certainly young adults that are going to school, they'll be able to keep that. But what is very important, that if you do get a letter when the work requirements go into effect, that you respond and make sure that you give Medi-Cal the information so you can keep it intact. Something Covered California agents learned just recently at a meeting is that Covered California said that if someone is terminated from Medi-Cal because they cannot prove that they are working or they have another exemption, like going to school or volunteering, if you are terminated from Medi-Cal because you do not meet the work requirements, then you cannot get the subsidy through Covered California. So it kind of locks you out, and that's a real nasty situation. And so you'd have to buy private health insurance without a subsidy. I mean, no one can really afford that because the health insurance rates are so expensive. So that was a real interesting twist a lot of us did not know about. So it's very important to keep Medi-Cal. And if you think you're going to lose it, I I guess that's when we need to work with people to try and get out of Medi-Cal so they can get into covered California and receive the subsidy. Because if they're terminated for not meeting the work requirements, they can't get into covered California with the subsidy. Beginning in January 2027, there will be 6-month checks for eligibility. Are you working? And so you're going to need to supply Medi-Cal with documents. And again, this applies to adults. Parents generally are not going to have to do the every 6-month verification process. But if you lose Medi-Cal, it's just a whole paperwork hassle. So again, if you receive anything, and this is ways down the road, always open it and see what Medi-Cal is requesting of you. Less time to get help paying old medical bills. So generally the way Medi-Cal works right now is if you're determined eligible, there's a 90-day look back. And maybe you've been in an accident and it's been a couple months and you're just finally getting on your feet, and you get into Medi-Cal. Medi-Cal can look back 90 days and pick up some of those emergency room costs and things of that nature. But now that's going to be shortening here beginning in July 2027. The look back period may be reduced to just 30 days for some people and 60 days for other individuals. So the look back and coverage of those medical bills won't be as generous, which means you may have a big bill, or someone may have a big bill that they need to deal with. Beginning in October 2028, there's going to be some co-payments for healthcare services, and this applies again to adults that are over the federal poverty level line, not pregnant, not on Medicare, and pretty much the Magi Medi-Cal crowd. And I assume that might be co-payments for an office visit or an X-ray, perhaps even prescription medications. I'm not really sure how it's all going to look. They don't know how it's all going to look. It's so far into the future. But they do mention that no one will have to pay more than 5% of their household income. But that could still be steep. And it will not apply to community health centers, rural clinics, emergency care, regular checkups, or prenatal care, mental health and substance use disorder treatment. So, but there will be co-pays for other routine healthcare services. So those are kind of the updates. The big one is that the work requirements will not go into effect in 2026. So you can breathe easy on that one, because that's going into effect in the next year. But things are changing, so always look at everything that Medi-Cal sends you and just stay tuned, because as these programs evolve, we'll get more information and we'll be able to put that information out into the community. So for InsureMeKevin.com, I'm Kevin Knaus.